4 weeks I went over to Vietnam, and I was based in a hospital called Cho Ray Hospital. It's the major trauma centre in Ho Chi Minh City, and so that's what I saw a lot of. Probably 10 motor vehicle accidents were coming in every hour. Some of them were local from Ho Chi Minh City, but a lot of the more serious ones occurred in the countryside, and they got brought into the centre. So I guess the thing I learnt was to relax a little bit more. They were very casual about the patients, and things here that we'd have a team of 3 nurses and 3 doctors managing, they just sort of leave the patient there and they were happy with their situation. And I found that quite hard to grasp at first. But it was really good to learn sort of principles of emergency management and sort of investigations that you want to order for these trauma situations. It was just a chaotic ED. There were probably about 20 beds in the ED and maybe 50 or 60 patients. At one time I saw 4 patients on a bed because they just didn't have the resources for separate beds. And I'd see relatives bagging patients because they didn't have the nursing staff or the ventilators for these patients. So it was very different. I mean, the ED here, it's, each patient has their own nurse, their own monitoring, their own bed. They have OBS done very regularly, whereas in Vietnam they just didn't have the resources for that. And patients who here we would be worried about and probably intubating and putting on a ventilator, they just kind of let them be because they knew they weren't in immediate danger and they didn't quite have the resources to do anything about them now. So that was very interesting. And another big difference was the use of CT scanning. For a hospital that wouldn't even give out morphine in the ED to a single patient, they were happy to put every patient through the CT scanner. A 3-year-old who'd just bumped their head would get a CT scan with no thought of the radiation exposure, or maybe we'll wait and see how she goes. Just every patient went through, but it was really interesting because most of them had some pathology going on, and it was almost as if the doctors, they'd been there and they'd experienced it and they knew that they would find something. And so when they're investigating an issue, they'd do a lot of investigations we might not think are that necessary. For instance, this 23-year-old backpacker had cellulitis of his foot, and they were sending him for an x-ray test to check for diabetes and basically a full health scan, whereas all he wanted was antibiotics, and he knew that he just had this infection and that the antibiotics would clear it up. But they were used to finding extra pathology, so they went over and above to look for something extra. So it was a really good elective for imaging. I saw lots and lots of imaging and got really good at diagnosing things, and it was also a good opportunity for practical skills. There was wounds constantly being sutured, and they were happy to let you do that. On the sicker patients, they needed ABGs done, they were happy for you to do that. Fast scanning on all the trauma patients, we could do that as well. So there was a lot of opportunity for hands-on skills and a lot of delayed presentations, so a lot of really interesting science to elicit. But overall I found the Vietnamese people really, really friendly. In Ho Chi Minh, they really were a lovely bunch of people. And I found the food was incredible. They certainly have some of the best food in the world, especially travelling up to Hoi An. Some of the best meals I've had in my life. And it was, Ho Chi Minh, it's a really big city. You walk around it and it's, like any other major city in the world, except really, really poor traffic rules. I think that was something I struggled with. The roads were crazy. I've been to Thailand before, and they made Thailand look tame on the roads. You just, every time you crossed a road, you're sort of risking your life because you just didn't know what would happen. And they taught me that when you're driving, you only consider what's in front of you. So it's the responsibility of the person behind to deal with whatever you do on the road. I was lucky enough to be there over Tet, which is the Vietnamese New Year celebration. They shut down whole streets to make designs down the roads where they repaved the roads and put out flowers, and with the Year of the Horse, there were just horses everywhere in town, lights lighting up the street. It was really exciting, and the Vietnamese were so excited about it. I think I went to 3 New Year parties at the hospital because they have one, for every department, every team, and it was a lot of fun.